Good evening, everyone. I'm Dr. Prashant Utage, working in field of child development and neurology since last 10 years. Today, we'll be saying few points about what is the efficacy of the antiepileptic drug, that is epilepsy medication, especially in children. So, what is mean by epilepsy? As you know, any problem that creates a abnormal wave pattern in the brain that causes the seizure, and when there is a repeated episodes of seizure, we call it as a epilepsy. So there are many types of epilepsy, but for in general understanding, there are two type of epilepsy, mainly generalized epilepsy and focal epilepsy and epileptic encephalopathies. So when we diagnose a child having the epilepsy, let it be generalized or focal epilepsy, so we need to see how best we can do treat with the drugs. So what are the drugs we use for the medication used for the epilepsy? To name it, generalized epilepsy like levetiracetam, sodium valproate. In adults, they use the fosphenytoin, phenytoin. Then other drugs like lamotrigine. Then for focal epilepsy, oxcarbamazepine. Then other drugs like clobazam. Then parampenal, brivaracetam. So there is n number of drugs, topiramate. So many drugs are there. Let us talk commonly about the epilepsy drugs like levetiracetam. It is one of the good molecule which is used for to treat the epilepsy in the children. It is easily available in a syrup form and a tablet form and has to be given orally 2 times. When you diagnose with the generalized epilepsy or focal epilepsy, it is one of the best drug. Now the dose is 10 milligram per kg, and the adverse effect we need to monitor is that sometimes child may develop the hyperactivity, behavioral issues, or a drowsiness. But it is a safe drug. We call it as a levetiracetam. And has to once we have started the levetiracetam or antiepileptic, we have to continue it for 2 years. And after diagnose, start with the antiepileptic medication like levetiracetam, and before stopping, we have to do the EEG. We should not miss that dosage at all and monitor frequently. Consult your doctor so that any adverse effect we can diagnose it. Now, other molecule like sodium valproate, it is again one of the good drug, but toxicity is one of the major concerns, so need to monitor it. And other adverse effect child may have the cognitive decline or may have the hyperactivity. And the dose is again 10 milligram per kg. Maximum we can go up to 40 milligram per kg per day. Other good molecule is the clobazam, which is used in a febrile seizure and generalized epilepsy also. Sometimes in acute control or short-term prophylaxis, we use the clobazam. Dose is like it's easily available, and adverse effect may be the child may develop the hyperactivity, irritability, drowsiness. So need to be careful. Now other drugs like lamotrigine, again one of the good drug, especially in a generalized epilepsy which is not responding to the valproate or levetiracetam. So along with the valproate, we can use the lamotrigine. So it gives a good control, especially in the epileptic encephalopathies also. But side effect is the Stevens-Johnson syndrome or skin rash. We need to be very, very careful with this drug. Rest of the things, it's quite good drug to be used under medical prescription and supervision. Other drugs like oxcarbamazepine, this drug is used to control the focal epilepsy, and commonly dose is 7 milligram per kg, and maximum you can go up to 15 milligram per kg. Now the adverse effect is again the Stevens-Johnson syndrome, so one should be very careful about that. And second one is the hyponatremia. So these are one or two, and drowsiness also. So one or two side effect which we need to monitor it. Otherwise, it's good drug. Now nowadays we are using the lacosamide, which is one of the good drug to control the focal epilepsy. Initially, there was very less data whether to use the lacosamide in a pediatric population or a children or not. But nowadays, it's getting like used by the many pediatric neurologists in a child whose age is more than 5 years or 4 years. So it's one of the good molecule for the focal epilepsy to start with, and results are quite good. Other side effect, maybe there will be a little bit drowsiness, but no major life-threatening events with the lacosamide. Okay. Rest of the drugs like topiramate, zonisamide, then vigabatrin in special situations, then brivaracetam. These are the other molecules. So we need to choose medication very wisely. Suppose any child, like rest of the medications like phenobarbital, we then after phenobarbital, iptoin. But nowadays, because of availability of newer medications, we are not going through it. So medication once started has to be monitored. You need to frequently visit your doctor as and when required, and monitored with the EEG also. So we should be taking care of that. Thank you. Thanks everyone. More 30 seconds.